Doctors don't always get it right. And today we are going to talk about 5 health myths that doctors wish you would stop believing. Now, this is not intended to disrespect any physician out there, but these are 5 things that many physicians believe that actually have very little science to back them up. These are things that patients often hear in the doctor's office that they then go home and tell all of their friends and family. And so today, I want to educate you on the 5 things that doctors wish you would stop believing. Number 1 is cholesterol does not cause heart disease. When you go to your doctor and they check your cholesterol, specifically if your LDL is high, your doctor may tell you that you need to lower your cholesterol because it increases your risk of heart disease. This has been a long-held belief in medicine for decades now. But the truth is that this is not entirely true. There are several studies that show that even if you have very high cholesterol, if you live a healthy lifestyle, especially if you are getting regular exercise, eating healthy foods, not smoking, etc., you do not have an increased risk of heart disease. And also, some people who have low cholesterol can develop heart disease. So what is the takeaway? Well, your total cholesterol is probably not that important to focus on. What is more important to look at is something called the atherosclerotic burden in your arteries, and this is actually looking inside of your arteries to see how much plaque or atherosclerosis is there. And there are ways to do this without even opening up your chest, which I'll talk about next. The second lie that doctors tell patients is that you need to get an angiography. If your doctor thinks that you might have clogged arteries, they will sometimes recommend getting an angiography. This is a test where they inject dye into your arteries and take pictures. The problem with this test is that it's very invasive. They have to stick a catheter into your artery, usually in your groin, and thread it up through your vascular system until it reaches your heart. And then they inject the dye and take the pictures. Well, what happens if they find something on the pictures that looks abnormal? You're going to be told that you need a cardiac catheterization. This is a much more invasive procedure where they actually go in and pull a sample of the blood from inside of your heart. The problem with this test is that it's extremely painful, it's expensive, and it has significant risks. In fact, one study found that 9% of people who undergo cardiac catheterization end up dying from complications of the test. So if you have high cholesterol and you're worried about clogged arteries, I highly recommend that you get a coronary artery calcium score instead. This is a CT scan of your heart that takes pictures of your arteries without having to stick anything into your body. It's quick, it's painless, and it's extremely accurate. The third lie is that you need to take a daily aspirin to prevent a heart attack. Many doctors recommend that people who are at risk of a heart attack take an aspirin every single day to help prevent a heart attack. However, this is actually not true. There was a study done called the Aspirin Myocardial Infarction Study, or the AIM-HI study, that looked at over 12,000 people who were at risk for a heart attack. Half of the participants were given aspirin every day, while the other half were given a placebo pill that did not contain aspirin. What they found was that there was no difference in the number of heart attacks between the two groups. So why do doctors still recommend this? Well, they are thinking of other benefits of aspirin, such as preventing stroke or reducing inflammation in the body. But again, the research is not totally clear on whether aspirin is actually helpful for those things. And aspirin does have side effects, including stomach bleeding and ulcers. The fourth lie that doctors tell their patients is that statins are safe. If you have high cholesterol, your doctor may recommend taking a statin medication. Statins are drugs like Lipitor, Zocor, Crestor, and they work by lowering your cholesterol. However, there are significant side effects to taking statins. One of the most common side effects is muscle pain and weakness. This is because statins inhibit the production of a molecule called coenzyme Q10, which is found in all of the cells of your body, especially your heart and your muscles. Coenzyme Q10 is an antioxidant that helps protect your cells from damage. It also helps your mitochondria, which is the part of your cells that makes energy. When you take statins, your coenzyme Q10 levels drop, which can lead to muscle pain and weakness. Other side effects of statins include liver damage, kidney damage, memory loss, and an increased risk of diabetes. The fifth lie that doctors tell their patients is that diabetes is not serious. If you go to the doctor and they tell you that you have diabetes, they may reassure you by saying that it's not a big deal and that it's totally under control. But this is not true. In fact, diabetes is extremely serious and it can lead to a lot of different complications, including blindness, kidney failure, heart disease, and even death. For example, one study found that people with diabetes have a 4 times greater risk of having a heart attack than people without diabetes. Another study found that people with diabetes have a 5 times greater risk of stroke than people without diabetes. The reason why doctors may tell their patients that diabetes is not a big deal is because they may feel like they have to reassure their patient. After all, a diagnosis of diabetes is not exactly something that you want to hear. However, it's important for people with diabetes to know that they need to take their health very seriously if they want to prevent complications. The good news is that there are things that you can do to help prevent these complications. One of the most important things is to keep your blood sugar levels within the normal range. This can be done with a healthy diet, regular exercise, and in some cases, medication. So those are 5 lies that doctors tell their patients. Now, I'm not trying to bash doctors here. I respect the hell out of doctors. I used to date a doctor, and in general, they have a very difficult job. They go to school for many, many years. They have to memorize a ridiculous amount of information, and they work very hard to help their patients. However, just like anyone else, they make mistakes, and sometimes they repeat the same mistakes over and over again, even though there's no good evidence that they work. That's why it's important for you to be your own health advocate and not just blindly believe everything that your doctor tells you. Do your own research. Ask questions. And if something doesn't feel right, get a second opinion. You are your own best health advocate. So don't let anyone, including doctors, tell you what you should do with your body. If you want to learn more about the 5 biggest health scams, click on this video next.